Hello and welcome to the channel. My name is Jess Reynolds, and today I want to talk about wrists and forearms, and in specific, cupping them. Now, cupping the wrists and forearms is really awesome if you can do so effectively. As we know with cupping, it has a world of health benefits, but when we're dealing with the wrists and forearms, it's oftentimes quite difficult to get the cups to stick effectively. So today I am going to show you the types of cups I use and the techniques that I use to treat wrist and forearm issues. This is largely going to be things like ganglion cysts, maybe a history of carpal tunnel syndrome, or even tennis elbow and golfer's elbow. So with that, let's jump into the demonstration. So let's talk about cupping the wrist. Now this is an area that really gets neglected when it comes to cupping, and you know what, for good reason. It's quite an awkward area to cup. It's mostly bone, but there are a number of conditions that occur within the wrist that cupping can be incredibly beneficial for. One of which is going to be something quite common in the world of massage therapy, and that is massage therapists get this, and that's going to be a ganglion cyst. Another reason we might use it within the wrist is perhaps somebody has a history of sprained wrist or any other type of surgery, maybe even they've had carpal tunnel syndrome surgery. Nevertheless, it's a very important area to be able to cup skillfully. The real key is having the right tools. I have a small set of cups here that come from Global Cupping. You can check out the link in the description, and you can use the coupon code AIM online to get 15% off. They're not sponsoring this video, it's just a coupon code for you to use. The reason I do suggest them is because they've got these really cool sets of cups. A lot of the different cups are going to come with numbers on them. Now, those numbers are incredibly important because they're going to tell you the firmness level of the cup. So if you've done a lot of cupping, you might notice that some sets of cups, they're really loose and easy to move, whereas other sets of cups, they can be very firm. With Global Cupping, you can choose what firmness level you want. So I'm going to be using these two types of cups here, but I'm also going to play around with these cups. Now these are typically called facial cups, but what we'll see is they're also very effective to use on smaller regions such as the wrist. And then the last cup is going to be this interesting sort of pop-up cup, which I find can also stick very well to those less easy to access areas. So let's jump in and do a demonstration. All right, so I'm going to get these cups out of the way here. Make sure that your client's arm is somewhere that's nice and relaxed. So we can actually see here that Brianne has this small little scar, which is from a ganglion cyst surgery. As I mentioned, these are very common in massage therapists. Of course, Brianne is a massage therapist, so had a history of a surgery there. And this scar is something that we could spend a lot of time doing fascial work on, or we can use our cups. So the first cup I'm going to demonstrate is going to be this larger dome cup. So I can apply the cup to the area and just squeeze it and see if it sticks. Now it's not sticking, which I'm not surprised of because Brianne has rather dainty little wrists. We could, however, use this cup somewhere else on the forearm. Maybe she's got tennis elbow and we could stick the cup on her forearm up there. But because her arms are smaller than the cup size allows, that's when these facial cups come in really handy. Now there's a number of different types of facial cups you can get, but I really like these shape. They're easy to use, they're relatively soft, but most importantly is because they're made out of that soft silicone, they can contour to any of the bones. So in this case, I'm going to start right here on that scar. Now if your client doesn't have a scar, you could start anywhere on the wrist. And I'm going to begin with classic flash cupping. Now when I do flash cupping, I'm squeezing the cup, applying the cup, releasing the squeeze, and then pulling the cup off. Squeeze, apply, release the squeeze, pull it off. Now, because the wrist area tends to be fairly robust, this is an area where if you so choose, perhaps on that scar, you could apply a cup just like that, and you can let it sit there. We do want to make sure that we're paying attention to these cups if we leave them, because it is a bit of an oddly shaped area, so even if you get great suction right on the area you want to work, it's not unusual for these cups to spontaneously lose suction in the fall. We don't want that because then we've got to go and wash the cups, and it just takes time out of our client's session. So if you do apply a cup, make sure that you've got a hand nearby that's going to prevent it from falling on the floor. And then if you so choose, you could take another cup and you can work elsewhere on the arm. Maybe you're working on up here for the extensors, or you could do moving cupping, which I'll show you in a moment. Before I do a demonstration on moving cupping, let's hear from our sponsor. This video is brought to you by Jane EMR. They really are a one-stop shop for all things clinic management. One of the things that I really appreciate about Jane isn't that they have everything you need packed into the software, but if there's something that is unique to your case that Jane for some reason doesn't do, they have a fantastic integration system and they integrate with a bunch of other tools. So they really allow you to make Jane your own. You can customize it in a way that fits your use case best, regardless of whether you're just starting out, you're doing a mobile business and it's only you, or you've got a wellness practice with 10 different modalities and 50 different practitioners. Jane's got you covered. So whether you're switching from one EMR to another, or this is your first time jumping into the world of electronic medical record systems, Jane's got you covered, and you can get a 1-month grace period on your new Jane account by using the code AIM1MO when you sign up. All right, so let's now try out that moving cupping. I'm going to take this off just so I don't have to pay attention to it. I'm going to apply a small amount of lubricant here. As you know, with moving cupping, you do need to have some type of lubricant, and ideally it's one that's not going to be absorbed by the skin too quickly, so I typically suggest avoiding lotions. Now with moving cupping, because these cups are so small, it doesn't really matter if I go proximal to distal or distal to proximal. If I'm going to be going proximal to distal, I'll apply the cup, and you see I'm holding it near the base. By holding it near the base, just like this, I find it pops off much less frequently. So I can gently move the cups down. And how are you feeling with that one? Great. You do want to check in when you're cupping on the forearms, because even with these small face cups, sometimes it can be quite intense. And I'll just show you what I mean. If I grab up here too far on the cup, see how it angles like that? It's much easier for it to pop off. Yes, I can try and leverage it properly, but it's just easier to grip on down here. Then we could go the opposite direction as well. We are getting pretty good suction on there. Now, we could do the same thing on the wrist itself. A little harder, so we might need to use smaller cups. Now this set of cups comes with very, very tiny cups as well. Again, this is the face cupping set that you can find on Global Cupping. You might find it a little bit easier to do moving cupping with these smaller cups. And it really might seem like you're not getting a lot done with these small cups, but I can assure you, you are. You can even notice that the forearm is still a little bit red. And we could, of course, do the exact same thing on the flexor surface of the arm. If somebody has a history of carpal tunnel, or if they do have just soreness on the flexor side of the arm, I do quite a bit of climbing and find that my forearms get sore, and I think cupping would be very beneficial for them. So all I'm doing now is just applying a little bit of that excess lubrication that I had from the extensor side, and the same thing. I'm going to use the same cup, and I can do moving cupping. As I start to get close to the cubital crease, I'm just going to purposefully pop the cup off. I really don't want to be cupping over the cubital crease. There's nerve, artery, and vein that goes through there, and it's a very sensitive area, so we'll avoid cupping there. We could move in the opposite direction, just as we did on the extensor side. And one of the things you'll notice is look how much more red the flexor surface is than the extensor surface. Be very mindful when you're working on both sides of the arm, but particularly the flexor surface, because we do want to make sure, just like everywhere we cup, that we're not leaving big cupping marks. If you do, it's not the end of the world by any means, but we attempt to cup without those marks. Now let's move into the wrist right here. So the carpal tunnel, as we know, it's actually on the palm of the hand, not the wrist proper. So if we are cupping the carpal tunnel, I want to be right there on the palm of the hand. And again, it's a very strange area because there's a lot of different folds and the tissue can bunch in strange ways. So one of the things that I'll do is I'll just use this other hand, spread the hand open like this, and then apply the cup. And just like before, because it's such an awkward area, it's pretty common for the cup to spontaneously pop off. So I'm just going to keep this hand here and make sure that it doesn't pop off. Good. And we can also cup the entire palm of the hand, which for some people feels really good. For other people, it just feels meh. So you do want to have a conversation with your client. There's no point in spending time on a technique if your client is like, whatever. I don't really like it or hate it. But it certainly is possible to cup the palm of the hand. And again, I'm just using this thumb to leverage her thumb out so the hand doesn't fold in on itself. So there you go, that's how to cup the wrist and the forearm. If you're interested in learning more about cupping, check out the link in the description. I have a full course on how to cup the entire body. And with that, see you next time.